Hotspots, if you have a dog, especially if it's a long-haired dog, for example, it's very possible that he or she may have one. I would recommend year-round prevention, even if the risk is less so in the winter months. The cone of shame, the Elizabethan collar, that's the key.
So they make a call to you, they bring your dog in, they got a hot spot. How do you treat it?
Yeah, I mean, I guess I would ask some questions before going ahead with treatment. You know, there are diagnostics that can definitely and sometimes should definitely be done before empiric treatment. But oftentimes, I will be honest, the case, you know, I can mention to the owners, you know, the utility of doing an impression smear where we kind of put a glass slide up against one of those aforementioned pustules that, you know, pop it so we can get that pus and bacteria, get it on the slide, take a look under the microscope, look for specific types of cells, bacteria, neutrophils. You know, that can be very useful baseline diagnostic. Most owners really don't care. They just want to treat it. And I get that, like, and I don't always do, you know, cytologies, and don't jump to like the more extensive diagnostics, especially if they're not considering that. So typically how will I treat it? I'll shave the area, you know, a little bit past where I'm seeing initial redness or pus, and until I kind of see healthy skin. Shave that area. We have like chlorhexidine, gluconate, topical wipes, kind of clean that up, and then I'll send home with antibiotics. I usually choose cefpodoxime, and, you know, recommend once a day. And depending on the severity, or if I see any evidence of like folliculitis and, you know, some hair follicles that are affected, I may do a longer course than I would otherwise. But typically what owners should be thinking about are, you know, on the order of 3 to 4 to maybe 6 to 8 weeks for, you know, really, really bad lesions. And we'll talk. I know some of the questions in here may, you know, come up with, you know, home remedies and homeopathic flavors to stuff. But I am of the mindset that antibiotics are super important. Now, there are topical ones, and then there are the oral systemic ones, like the cefpodoxime, and which can definitely cause some adverse reactions. You know, you can see gastrointestinal upset when we give that. But for me, in the vast majority of cases, the benefits outweigh the risks, because the dog needs, like, the mainstay of therapy here is antibiotics.
Do you prefer topical versus oral, or do you prefer oral?
Yeah, I mean, you'll ask one vet, you'll get, or 2 vets, you'll get 3 opinions, especially those who, you know, are more into the homeopathic trend. And there's, you know, the multiple ways to skin a cat, give the reference.
Or skin on the cat. Yeah,
exactly. The multiple ways to skin on a cat. The goal here is to just stop the trauma and to prevent development of future trauma. And so, you know, sometimes cost is an issue. You know, there's, you know, if I have multiple patients in one day to treat, you know, the same essential thing, which is a hotspot, which is often the case because skin and vomiting, diarrhea are like the 2 most commonly commonly seen histories that I'll see in a given day. But I may treat them very differently, depending on owners' wishes, owners' comfort levels, like giving oral meds. You know, oral medication is generally some of the easiest things to do, but a lot of people do, you know, for, you know, if they may have a disability, or they have, you know, problems opening the mouth, like, or they think the dog, you know, they'll hide it in the treat, but their dog's too smart, which is often the case. there are a lot of challenges when it comes to, there's no one size fits all therapy. So generally speaking, I'm pro oral systemic antibiotics for hotspots, but I will not end up prescribing that to all my patients. But in some form, whether it's, topical, shampoos, so chlorhexidine shampoos, or miconazole, which is an antifungal, but has antibacterial properties. That's also a really good one. And it really depends. But I'm always going to recommend what I think would be best, which is pretty much always usually cefpodoxime. And that's really based on the typical susceptibility patterns of staph, pseudointermedius, which is one of like the main bacteria that's going to be colonizing on our skin, and that can kind of get in the area and then start to proliferate. So because I know cefpodoxime is going to be indicated for that species, that's the one that I almost always choose.
How do your treatments vary for the underlying conditions, be it dog's got fleas, the dog's got whatever, the dog's got a food allergy, the reason why they're itchy and scratchy, how does that affect your treatment?
Yeah, I mean, that's huge. I always tell the owners, like, this didn't happen out of the blue. Like, there had to be some sort of stimulus that triggered it. And we may not always find out on the physical exam or based on what the owner has provided to me in the history. We may not know what is the cause for it, but we like to control for some of the biggest ones. And I definitely think flea allergy dermatitis is a huge one. And I always recommend that an owner will, especially if they are not currently, up to date on a monthly preventative, or, every 4 times a year, if it's something like Bravecto, chewable that lasts for 3 months at a time. I always recommend that they get on that. But definitely, like, I'm going to do a full physical exam for every patient that comes to see me. And, if we see a lot of inflammation in the ear canals, or that's kind of the back of the ear is where I'm seeing the excoriations and kind of the redness or, bleeding or anything, we'll do a swab. I'll recommend an ear cytology. We'll try to start treating the underlying cause. And that could be, some otic solution in the ear canals. It could be ear mites. It could be, who knows? Could be anything. Yeah, yeast. Rod-shaped bacteria, spherical, like cocci. So all sorts of different things.
So basically, you're a detective at this point. You're trying to figure out, and you have to treat the underlying condition, because if you just treat the hot spot, you put cream on it, you shave it. Well, if the dog's going to be itchy, it's going to happen again and again and again. Yeah. And that's something we have to communicate with owners and say, listen, I know you don't want to spend extra money for ear swab or whatever it is, but you're going to keep coming back for this, or you're going to try to treat it at home, and then it's going to get worse. How much do you normally shave? Say on a quarter-sized lesion, like how far out do you go?
Yeah, I mean, I think going at least another centimeter or 2 around it would be sufficient. As soon as I kind of see the nice, healthy underlying skin beneath the hair. But yeah, I'm pretty liberal when it comes to that. Unless an owner, like, not even unless, like, they'll demonstrate. Most of the time, people are, pretty understanding that this needs to be done, and they're cool with it. But periodically they'll be like, "Oh, don't do this." But we need to see what we need to see. So I try to, my hands will be all over their pet, not even just in the specific area that they're worried about or that the dog's been licking. So if I feel, some sort of crust or something moist in a different part of the dog, I'm going to recommend that we also shave that area, because sometimes these things can kind of fly under the radar.
Right. Yeah, my poor dog looked like a checkerboard when I would get done with him because I'd be petting him and go, hotspot, and bring him into work and just shave a big old square around it. And then, there's another one, shave it and get him on antibiotics. So that's a constant battle. So,
poor Dale.
I know, he was a great dog, but, he got a little weird with his brain tumor though. He started having seizures, and then it was one of those things where, I worked at a specialty clinic with neurologists. So like I'd bring him in and go, help me. And they would look at him and see like half his face is a little sunk in, and they would say, okay, something's probably going on over here. And we put him on anti-seizure medication, and that stopped his seizures, but it completely changed his personality. He was no longer the dog I knew. He'd walk around like, oh, this is new. Hi, who are you? What's going on? And it got to the point where he snapped at my kid at the time who was a baby, and he would never do that ever. So it was like, I can't have him around with possibly hurting the baby. So we had to put him down, but it was tough. But anyway, that's a sad story. We're not doing sad stories. We're talking about hotspots. Home remedies for hotspots. Do you recommend people do home remedies for hotspots? Pouring witch hazel or essential oils on a hotspot at home? Do you think any of that helps?
I don't. I would definitely recommend.
I'm gonna get you in trouble with all the essential oil people.
Right. Well, come at me, bro. Essential oil people. No,
I put peppermint on there. Yeah.
Everyone wants to do what's best for their pet, and there's a lot of there are a lot of natural treatments out there that can be helpful. And like with whatever anti-epileptic drug that Dale was on, kind of circling back to that, no drug is benign. So even the antibiotics, which I pretty much always will be recommending for hotspots, I always alert the owners, for potential side effects. And there are a lot of homeopathic and home remedies that, I did a Google search and preparing for this to kind of see what's out there.
Let's hear it.
Hydrogen peroxide, I saw some sites that say definitely. And then I'm thinking in my head, no, let's not do that.
Why not? Why would you not recommend
H2O2? Yeah, H2O2 is, we have it in the clinic, we have it in our houses, in the the cabinets, and it's a readily available option. So I definitely understand why people think that it's good for for us sometimes, scrapes and but it burns, and I do feel that the science behind the oxidative damage and while it will kill a lot of surface bacteria, it's going to delay the healing process by also kind of interfering with the body's response to the trauma and potentially like slow healing. Right. So and it burns. It really is no fun. But I did see other things.
And it's also one of those things where it when we would get blood on our scrubs, we'd spray hydrogen peroxide on it because it breaks it down. It's easier to clean out. Yeah. If you want something to clot or to heal up, why are you dumping something that's kind of caustic on there? You're right. I think it burns. It's bubbling. It's working. And meanwhile, your dog is screaming around the house.
Pretty much. Definitely no fun. So that's something that I would avoid. I saw calendula, which it's a little salve that we have from the marigold plant. Okay. It has some anti-inflammatory properties that if an owner if it's cost prohibitive to come to the hospital, obviously we would like to see their pet, because we need to kind of diagnose officially, because it could be something else, but that could be a good option. Aloe vera can be soothing. We don't want obviously our dogs to be licking this. So definitely the e-collar for sure is a must. I mean, it's really half the battle, just preventing them from licking the lesion.
I was going to get into that next. Yeah.
Yeah. So, I mean, that's half a home remedy in and of itself. If an owner is vaxxer, anti-antibiotics, no drugs for my dog, which we do have a lot of. I have a lot of clients who are like that. But when push comes to shove, depending on the severity of, if it's skin lesion or gastrointestinal upset or whatever the case may be, then, if it's causing too much of, they decide it, they call it on their terms. But if it's really, they understand that this is a big deal, then they'll obviously opt for certain diagnostics or drugs. But there are a lot of people who don't want that for their pets for whatever reasons it may be. But yeah,
I like my dog like I like my chicken with no antibiotics.
There you go. GMO free.
That's right, no hormones.
No GMO. But yeah, so I think calendula is a good one.
Okay.
Yeah.
So in terms of keeping your dog from licking, can you tell them stop licking, and they're going to listen to you, right? That's what dogs do, isn't it? Don't they they stop when you tell them no? Yeah.
If only they could, if only we could talk to the animals. Who was it who sung that?
Talk to the animals, walk with the animals.
Yeah.
Oh, I'm gonna have to
go right something Junior, Sammy Davis Jr.
Okay.
So anyway, if only we could talk to the animals. We can. They're not going to talk back, and if they did, they would be like, "Hell no, I'm going to be licking this."
So what do you do? How do you keep them from licking it?
So the cone of shame, Mike. That's the answer. The cone of shame, the Elizabethan collar. Yep. That's the key. Now, some owners don't like that. They want the soft collar. And I'm okay with that so long as it's truly going to prevent that, like depending on the location of the hotspot. For soft collars, they could probably potentially still reach at the tail. But if it's kind of, on the back or the flank, the soft collar might do the trick. But you just need to create some barrier from the mouth to the actual lesion. And I always recommend to owners, and sometimes, they'll, while they're sleeping, or at the house, they'll put it on, but throughout the day, if they're home, especially now during COVID, when a lot of people are homebound, they'll, have it off because the dog is happier, but they'll just monitor from the background. But inevitably, like, the dog will still be licking, and the proof is in the pudding, because when I see them back for a recheck or something, you can tell.
Right.
You see the surrounding hair that might be a little bit, wet, or it's happened. So, but the most we can do is recommend, and hopefully the owners will listen.
Yeah, for me, it's working in a surgical practice. We would send home the collars all the time.
Sure.
For the dogs, because they have incisions. You don't want them licking.
No.
And for me, it's there's so many different types of e-collars. You can buy them in the store. You can buy them, wherever. You've got the regular e-collar, the kind of white plastic. There's clear. They've got black ones. They've got the inflatable donut collar. You've got the bite knot collar that looks like a neck brace that they wear, and it's got the strap that goes around their front leg so they can't get it off. For me, when you're buying an e-collar, if you want to buy one at the store, you need to make sure it goes beyond their nose when you put it on. I see so many people come in with an e-collar that's back, at their ears, and the dog can get around it. And yes, your dog's going to hate it. He's going to hate the e-collar. He's got this thing on his head. His head is all of a sudden twice as wide. He's going to run into doorways. He's going to freak out, and you're going to feel sorry for him. And yes, you're going to take it off, and they're going to go to town on licking it, because as much as we love our pets, we can't trust them to not do what comes natural to them. And yes, if depending on where the lesion is, and that determines least to me, what collar you need to wear. If it's something that's up here on their shoulder, then, you know, an inflatable one will probably be just fine. But if we had dogs with knee surgeries that they would put the inflatable on, and the dog just curls around the collar and licks all his stitches out by the time he gets home.
Yeah.
And has
They're very resourceful. They're very resourceful.
All they have is time.
Yeah.
All they have is time and a desire to lick. So that is
the surgeon's worst nightmare. All the, you know, the sutures, or you know, all the work that they've put in, and then it could be done it could be all for naught within you know, a few minutes of licking and chewing.
Yeah, and we've had to redo like TPLO surgeries because the dog has gotten in there and just chewed the fool out of his incision, his muscle incision, and it's all apart. And you know, the dog, it's not the dog's fault. Dog does what a dog does.
True.
Yeah. True. And also in the audience, we've got about 10 more minutes. If anybody has any questions, put them in the chat. If you registered on the page there, the Rockwell Pets page, and it'll pop up and we'll answer them. So we shave the hair, treat the lesion, put them on antibiotics, put the e-collar on. You said depending on the severity, you're looking at maybe 6 to 8 weeks. So it's definitely not an instant. You're not going to shave it. The dog's going to come home with perfect skin. Everything looks great. Yeah. Owners have to be that, you know, and they should understand that this is not going to be, you know, an overnight process. And sometimes they can heal remarkably well, especially younger pets. But yeah, I think that they should be realistically looking, depending on the severity and extent, you know, several weeks. And generally, it's, you know, the official guideline would be to you know, finish the antibiotics, you know, be a 1 week past resolution of symptoms. How can people prevent hotspots? That's a great question, Mike. Can they prevent hotspots? They can. They don't always need to go to the vet when it gets bad. They can reduce the frequency of needing to come to see us by taking care of, you know, some very, very doable, frankly, preventative measures. So first, and probably the biggest one that I could say, would be flea and tick preventative. So it could be of the oral variety. You know, you got the Bravecto option. You could do topicals. You could do the Seresto collars. A lot of different options to go here, but that would be the biggest one for me, because I feel as though that's one of the. Forgive me. Got my cousin calling through. Talk to him. If he later wants to ask a question, just put him on. I'll send him through. He didn't have to call you. Yeah. Yeah, fleas and ticks. We want to get them off, and flea bite hypersensitivity is one of the, you know, the big reasons here. Ticks, maybe not so much. You know, it's very. I've seen dogs who have like hundreds of ticks on them. It's awful. Usually in the summer and the springtime. But actually, last month here in New York, we had this blizzard, and like late December, and I had a Westie come in with a tick on him, and middle of the winter, you know, it was like 20 degrees or something. It was crazy. Wow. And, but really, I would recommend year-round prevention. And even if the risk is less so in the winter months, you know, fleas could be anywhere in the household. And I think the cost relatively of prevention is far below the cost of, you know, treating when kind of times get rough. Sure. So that's the biggest one that I would recommend as a vet. And the hassle of treating too. It's not just the cost. Yeah. It's the hassle of giving your dog meds, giving your dog an e-collar, dealing with the dog bagging in the back of your legs with the e-collar. And the fact that it's gotten to that point, you know, they're feeling badly from it. So, you know, I'm all for preventative medicine.
And I think that's one of the biggest gifts that we can give to them, just because, they're not showering as regularly as we are. They have hair all over their bodies, and we can't be checking. They can't talk to us when they initially get an itch. So
is that another prevention? Bathing? Is that keeping them groomed, keeping them brushed?
Yeah, exactly. And don't necessarily see your vet to get groomed, because we won't do a great job at it, admittedly. Especially for like the long-haired dogs. I had a Schnauzer the other day that matted fur all over her body, and she did have an infectious wound. Unfortunately, there's a neoplastic or cancerous underlying cause. So she's going to be coming in for surgery. But, it was just kind of a necrotic infected wound that it needs to be surgically repaired. So, a lot of these, pyoderma, if untreated, or if there's, a separate cause, there's all sorts of other things that you look for. We didn't really talk about endocrine diseases, Cushing's, that can kind of show some skin changes, but sometimes you can kind of see stuff that we've been talking about with Cushing's. But yeah, this dog, long story short, she had matted hair everywhere. And I just wonder if, if she had been groomed and gone to somewhere, maybe at least, seasonally, this could have been not necessarily prevented, but picked up sooner in the course of infection.
Right.
Yeah.
What about diet?
Diet is a big one, especially, dogs who have a food allergy, and it may be established earlier on in the course of life, or if an owner is kind of playing around with different brands and, different protein sources, and it's kind of all a mix. And then you get the diet history, and then you're like, oh, you have these raw foods, you have rabbit hide or some crazy thing. And I'm like, where do you get this stuff? And you get this boutique variety food, and it's just all over the place. Diet's definitely something that I look at. It may not be the first thing that I think of when I think of hotspots, but definitely if there's a recurrence, and we've treated it successfully, a couple months later it comes back, maybe there's also concurrent GI upset, then definitely I think of those historical issues as potentially being related to diet. I need to find out from the owner what the protein source is. Have you given it anything besides the food? And depending on what the case may be, we may be recommending some different diets.
And that's where your experience comes in, to be able to see the different pieces and be able to put it together to get a complete puzzle.
Oh, for sure. Yeah.
So yeah. I want to let people know they can go to rockwellpetspro.com and use the promo code SPOT, S-P-O-T, not the name of your dog, but as in hotspot, for $10 off probiotics and natural dog bone broth with turmeric, which sounds delicious. I might have to have some of that later. But dog bone broth, it sounds weird. So we're just about done here. We didn't have any questions tonight, which is very sad. Hopefully next week. Next week will be on Thursday night. And what are we going to talk about next time? Do you know what we're going to talk about?
I think it might be ringworm. I think that ringworm might be in the pipeline. So
ringworm, which is not a worm. Spoiler alert. Yeah, so
we'll say that for next time. But biggest misconception there.
That's right. Yeah, it's got to be a worm. So before we wrap up, Dr. Max, is there any message or anything you want that we haven't gotten to yet that you wanted to get out about hotspots, be it prevention or whatever it is that you want to tell us about hotspots?
Yeah, I mean, hotspots, if you have a dog, and especially if it's a long-haired dog, for example, it's very possible that he or she may have one during his or her life, and but they're treatable, and especially if you kind of recognize the signs early on. and bring him or her to your vet to be seen. It's something that can be fairly easily treated with good prognosis. But definitely, trying to find out what could be the cause is going to be always the most difficult part of, our job as a detective. But we can kind of help you figure out what the best course of action is. I once had, it was from contact dermatitis, and thankfully I had adequate self-control to not. It was crazy. I got it like I was out in Maine and with my cousins, and it started on my temples and it just traveled down to my chest and arms. It was ridiculous and scary, and thank God thus far, and hopefully not anytime soon, the only time that I've experienced this. But the skin is a crazy organ. It's our largest one, and it does weird things, and being itchy is just one of the worst. It's one of the worst feelings, and hotspots are a manifestation of that. So prevention is key. Spotting the early hotspot signs is key, and together we can figure a way to keep your pet happy.
Very cool. But I want to thank RockwellPetsPro.com. Once again, you go there, use the code SPOT, and you get $10 off probiotics and natural dog bone broth with turmeric. Otherwise, I think we're done. I think we've beaten hotspots to death for the last hour. It's been great. We'll be back next Thursday with ringworm. Thank you, Dr. Max. Hope you have a great week, and hope everybody feels better up there.
Amen. Hey, you too, brother. You too.
Yeah, I'm getting over it. So we're all good down here. So otherwise, we'll see you guys next week. Have a great week.